Hi, welcome to this webinar brought to you by Exercise Etc. Today's focus is strength training past 60. My name is Pete Rohleder, and I'm excited to be with you for the next couple of hours to talk about the most impactful ways to improve our strength as we age. Now, in the fitness industry, unfortunately, there are some myths that strength training is for younger people, that as we age, strength training just isn't for our older population. And that is the furthest thing from the truth. Strength training is an essential part of our fitness journey, especially as we age. And so in today's webinar, we are going to talk about the importance of strength training, the most appropriate means to strength train, and then of course, provide tons of exercises and ways that we can challenge our clients as they age. So if you're ready for the webinar, come along with me. Before we jump into it, I want to take a quick moment to introduce myself. I've had a long and diverse career in the fitness industry in the last 17 years. I've been a trainer, I've been a coach, a business owner, a consultant, an educator, a podcast host, and with all of that experience, the one thing that I try to do with whoever I'm working with, whether it's students or fitness professionals, is to bridge the gap between the science and that real world application. And hopefully by the end of this webinar, I do just that and give you some tangible things that you can take and integrate into your programming. This webinar has something unique. Embedded in the webinar are QR codes. These QR codes are extremely helpful. What we've done is we have added a way for you to access the videos found in this presentation. The presentation utilizes live action videos, as we've talked about, and each one has a very specific QR code that will link to a YouTube video in the presentation. So to access the video, simply make sure you have connection. Wi-Fi connection is the best. And then take your camera with the use of a QR code app, which you can download on any device, and use it to scan the QR code. When you scan that QR code, you will instantly pull up the videos that you see in the presentation, and you can save them and utilize them in the future. You can even create playlists in YouTube for specific videos that you like or that you would like to group together. Most smartphones, cell phones now have a QR reader, but if you do have an older device, you may need to download them from an app store. Again, most phones and current phones do have a QR reader app on the phone itself. Simply do a quick search on your phone, type QR reader, and it should pop right up. Further, if you don't want to do it all during this presentation, you can always print out the handout to this PowerPoint presentation and then highlight the exercises that you really liked or you would like to revisit so that you can go back and then use that QR code to then itemize and put these exercises together. As with any certification that you hold, make sure that you're aware of the number of continuing credits that you need to maintain your certification. This webinar provides 0.2 CECs or 2.0 CEUs towards your certification. This slide here is really to show you that we are approved by almost every major governing body in the fitness industry. So really it's just to tell you that you're in great hands with Exercise Etc. Let's talk briefly about how to get your CE certificates. First, view this complete webinar. Log on to the website, www.exerciseetc.com. Click on Administration at the top right of the screen. You will click on Strength Training Past 60 from the drop-down box. Enter your email address to verify the purchase. Complete the short 20-question quiz that is required, and then complete the brief evaluation. Fill out the other required fields, and then click Get Certificate. Your certificate of completion will be emailed to you instantly, and if you don't see it, make sure to check your junk or spam folder. It may end up there, but rest assured, as soon as you complete the above steps, that certification will be sent to you immediately. Remember to complete this webinar and print the certificate by December 31st of the same year in which you ordered it. Certificates with next year's date may not be accepted by your credentialing organization. Further, the webinar quiz is based on the printed material in this handout, not on the lecture. The webinar quiz sequentially follows this outline. All right, let's jump into the content. As I started this webinar, sometimes we buy into, or we are in a culture where we're training, where we believe that as we age, we become less functional and less able to do some of the things we did when we were younger. And like I started this webinar saying, that's the furthest thing from the truth. We want to make sure that as we age, that we are preparing ourselves for independence, that we are training in ways that will continue to strengthen us and support independent living. So the first thing that we really want to evaluate with our senior population is the ability to carry out activities of daily living. And that's where we need to start. First, we need to understand the basic activities of daily living, or ADLs. A clinical ADL assessment is used to determine whether a senior needs skilled nursing care, if they can continue to live independently, and what, if any, home health services Medicare may provide. It's very important. Being independent is something that is extremely valuable. And by doing a clinical ADL assessment, we are able to determine where our seniors are and what they need. And we talk about these activities of daily living. We're talking about the ability to dress oneself, personal hygiene, being able to eat, be able to ambulate, to walk, and to use the restroom independently. Those are those activities of daily living that we need to ensure we understand the capacity that our clients have. And if they are able to do this independently with some support or with needed support like skilled nursing. From there, we can take a look at advanced ADLs. And the advanced ADLs kind of progress into combination of basic movements and basic patterns of activities of daily living, but add a critical thinking component to it. In other words, it's not just the physical ability to do something, but the ability to use cognition, problem solve, critically think to solve a problem and to carry out that activity while performing the other physical activities of daily living. So some great examples: housekeeping. Housekeeping includes that ambulation, that ability to move from one point to another, but then the ability to coordinate movements, to critically think about where things need to go, the order in which you will complete things. Taking a look at medication management, making sure that we have the cognition to take the right medication at the right doses at the right times. Communication, being able to communicate with loved ones or anybody that you're working with. Transportation, again, not just physical ambulation from point A to point B, but the ability to transport oneself maybe from the house to the car. That's another thing to consider. And then from the car, being able to transport oneself where they need to go. Meal planning, preparation, again, lots of problem solving, thinking about ingredients, measurements, noting what's being placed in the oven, at what time. Are we multitasking? And of course, shopping and finances, the ability to balance a checkbook, to understand what needs to be purchased and when that needs to be purchased, making sure that we're able to execute all of these things while maintaining that independence with our activities of daily living. So these are the advanced ADLs, and this will give us a good understanding of where our client is. From there, it's great to have an assessment. And there are some very objective, field-based assessments that you can perform very quickly and will give you a good idea and some good insight onto the ability of your clients' activities of daily living and their independence. First one, simply watch your client walk for 20 to 30 feet. Seems very simple, but again, as fitness professionals, it's not just can you get from point A to point B, it's how do we get from point A to point B. So first and foremost, observe posture and gait. Do our clients have a stacked posture? Do they have from ear to ankle alignment? Or do we have some significant issues with our spinal positions and our posture? Do we have extreme kyphosis, where we have that thoracic kind of curvature, or extreme lordosis of the lower lumbar region? Further, as they ambulate, as they walk, how do they transport? Do they shuffle their feet? Are they able to take full strides and actually hit the heel strike with their stride through the midfoot, toe off as they go through a walking gait cycle? All of these are very important things to note and observe, because they will give you insight into their ability to not only move, but to react. That's a very important component. Is if an individual is not able to walk appropriately, any type of reaction response may disrupt their ability to maintain balance, and they could easily fall. And that's something to consider with not just seniors, but with everybody. That's why understanding posture and gait and balance are so critical. We want to make sure that we are setting our clients up for success. And when we talk about reaction, a lot of times people think of athletics or sports, but really daily life, daily living is a big agility drill. Agility is not just the ability to move your feet very quickly. Agility is, of course, the physical component, the ability to go from point A to point B very quickly, but it also requires a change of direction, the ability to make a decision and change the direction of your movement, which means controlling your base of support and your center of mass. And then thirdly, and most importantly with agility, is the perceptual cognitive ability. That is a huge component of agility, the ability to actually make a decision, have spatial orientation, to be aware of everything going on, and then of course respond to a stimulus and then carry it out physically. That is agility. And when you talk about daily life, that is what we do. Whether you are walking through a cluttered room and you have to plan your path to avoid tripping or falling, or you're walking in a busy store and there are carts and there are people and you're having to start and stop and turn and pause and then bend and pick up and grab. All of those things are a combination of the physical component as well as the perceptual cognitive. And so when we're looking at our training protocols, it's not just about can someone get from point A to point B, but how do they respond to other stimuli? Are there indications that there are things that we need to start addressing to ensure their independence and their mobility? That second bullet is what I just kind of elaborated on, is have them start and stop quickly. Are they able to control their center of mass? When our momentum is moving very quickly forward, can they stop and brace themselves using those core muscles, using those lower limb muscles? Very important. So as simple as these assessments are, the ability to simply modify them a bit, observe them to see strengths and weaknesses, can really pay dividends when you're looking at your programming. Secondly, observe how they get in and out of a chair. This is also very great assessment to observe without prompting, because again, when you prompt somebody, they are going to obviously adhere to your instruction and your cues, which means that they will fix whatever they're doing improperly if they can. Something I do with my students all the time is when we start talking about posture and I start talking about that slouched position, almost every single student will sit up really quick and fix their posture because I drew their attention to it. That is obviously not the state that they're in all the time. The state that they're in all the time is that slouched position, and I drew attention to it, which is great if I'm in a training session. But if I'm assessing, I don't want to give them those cues. I want to see them in their natural state. And same thing with an individual who's in a chair. Observe how they're able to get themselves up and down. Do they have to use momentum? Do they have to use their arms to press themselves up? Do they actually have to use an assistive device? Do they have to reposition themselves on the side of the chair before they can get themselves up? And then that's this bullet here talking about how they actually sit down. Can they control that eccentric squat, in essence, as they get to the chair, or do they fall into the chair? Do they lose their center of mass and fall into the chair? And again, these have implications. These are things to consider about their activities of daily living, specifically the toilet. Obviously, everyone uses the toilet, and the ability to sit down and stand up effectively is going to play into their independence or dependence. So that squat pattern, which we're going to cover here shortly, is essential for activities of daily living. Thirdly, have them stand on each leg. This is a very simple assessment that will really give you a lot of insight into their core engagement, their balance, and their coordination. Obviously, single leg stance is actually difficult for everyone, not just seniors, but for a lot of people. So make sure that you have support nearby when you do a single leg assessment. And really the goal is, can they lift one leg and stand on the other for at least 5 to 10 seconds? The goal is 10 seconds. And there are numerous studies showing the ability to stand and balance on one leg for more than 10 seconds can contribute to longevity. And as simple as that is, it can tell you a lot. So again, a simple single leg stance will tell you their ability to maintain core engagement, balance, and coordination. Finally, shake their hand. Obviously, when we talk about this post-COVID era, we obviously want to use proper hygiene, everything, but if you are comfortable shaking hands, this is actually a great assessment to see grip strength. Now, again, these are all objective and qualitative assessments. So really they are a bit subjective, really, if anything, because each person may not have a great grip when they shake your hands, but you can still determine if they have the capacity for a good handshake or good grip strength. Again, this is just a nice way to quickly assess where a client may be, because grip strength can also contribute to the ability to carry out activities of daily living, have the endurance to hold things, to actually grip things hard enough to use, either to stand up or to push or to pull. And so grip strength does play a huge role into our ability to maintain independence and execute our activities of daily living. So one of the best things we can do is to start at the foundation. And that foundation is our core. The word core is obviously a very trendy buzzword in the fitness industry, with the definition kind of changing and evolving over time. Initially, when we talked about the core many, many years ago, the core was really just focused centrically on those abdominal muscles. And of course, the core does include those abdominal muscles, but it was very specifically focused on like rectus abdominis and the internal and external obliques. That the definition of those muscles really determined your core strength. But as we've learned, the core has evolved, and we recognize that the core is more about spine and hip stability and stability during movement. And so many more muscles actually make up the core, and we need to understand the difference between those stabilizing and those moving muscles. When we talk about core stability, we're talking about internal isometric contractions to stabilize the spine and support the spine and the hips through movement. They actually help with that neutral spine position that we talk about, as well as alignment of the spine during different movements and different postures that we will sustain. When we talk about neutral spine, if you take a look at the picture to the right here, if you look at the one to the far right, you will see that natural curvature of the spine. And that spine, that curvature is absolutely essential. That curvature is the type of curvature we want in our spine. It actually allows us to have the significant freedom and mobility of our trunk and our bodies. Because of the way that it's aligned, it allows us to bend and rotate in several different ways and really execute movements in multiple planes. If you look at the picture to the left here, you kind of just see that frontal view here of the anterior view here of just a straight spine. And that's the visual people think of neutral spine as just a stick. Like if I had neutral spine, it would be a stick. My spine would be just like a broomstick. And that is not a neutral spine. Neutral spine has this natural curvature that we want to actually sustain during movement. That curvature is okay. Now, excessive curvature is different, and we will talk about that a little bit later. But when we talk about a squat, for example, so many people think a great cue is straight back. But again, straight back gives us that visual of a broomstick spine. We don't want that. We want a braced, stable spine. So yes, there's going to be this natural curvature, and that natural curvature is going to maintain that position through our movements as long as it is braced. And again, we will talk about that shortly. The goal of the core is to maintain neutrality regardless of the positions. And that's important to understand because that is the foundation. We need to support these positions first, and then we can move. Because if we don't have integrity and stability, and we start to add movement or even a loaded movement pattern, not only can we lose efficiency of the movement, we could lose balance, but then we could also set ourselves up for injury. So when we talk about the core, we're actually talking about two different things. We have a kind of an inner unit set of muscles that are focused more isometrically, stability, and an outer unit. And that outer unit is about the movement. And again, they work together. Here we have some pictures coming up in just a moment of the core. And again, you're going to be a bit surprised because the core is not just the abdominals. They start there. We start talking about these deep muscles that help stabilize. So we start talking about the transverse abdominis. We start talking about the multifidi. We talk about the rotatories. We talk about the pelvic floor muscles. Those are all muscles that are stabilizing muscles and that contribute to that inner unit of the core. But then as we start to add movement, we start looking at muscles from shoulder to knee because the muscles that cross the trunk and the hip all support the spine in the hip. And because they cross those joints, they are all considered the core. So we are looking at the internal external rotators of the hip. We're looking at hip flexors. We're looking at the glutes. We're looking at the erector spinae, the QL. We're looking at the pectoral girdle. And we're looking at the latissimus dorsi and the trapezius muscles because all of those will help stabilize and support and assist with movement. So when we start looking at core muscles, start thinking more synergistically. Start thinking about, all right, I need to have that braced position to stabilize my spine, but then I also need to improve the mobility or the movement patterns with these muscles in this braced position. And again, we will address that in just a minute. But one of the best ways to do that is to start by getting that core firing. And again, it's not just through abs, right? Not through crunches. Again, those are great exercises. They are a bit isolatory. You're going to focus on very specific muscles. But when we talk about the core, we want to get as many of those muscles engaged. And what we can simply do is do some resisted pushing and pulling patterns that will engage the core safely. And then again, of course, here we can cue positions to get as much core engagement as possible. So if we take a look at the first one here, we have just a basic pool ball or a kick ball that you can get at any major big store, any warehouse store, and we are simply pushing that ball together. Yes, are we going to work some of the pectoralis muscles and the deltoid muscles? Yes, but in order to really push, we are getting some isometric contractions going, and as we push, we are naturally going to have to engage those core muscles to stabilize. As you can see, we have Guy here in a standing position as well. With our seniors, again, we can always progress. So if we have to start in the chair, we can always start in a chair seated position and start with this exercise. We can then move to the edge of the chair, off of the back. Now that forces more core engagement, and now we have just progressed this exercise. We can then narrow our base of support, bring those feet together, or even put one foot in front of the other in a seated position. And now there's even more core engagement to help stabilize the trunk in that seated position. Of course, as you advance, we can get to this standing position. But this is a great place to start cueing posture, start cueing breathing, specifically diaphragmatic breathing, because the diaphragm is one of those core stabilizing muscles, and focus on maintaining this braced position. Of course, we can also do it with a pull pattern, just using bands. Just simply, again, pulling a band apart. We can hold that position as we pull apart. If we have seniors that have some shoulder issues, we can pull down. So instead of pulling up where our our shoulders are abducted to 90 degrees, we can simply be at about a 45-degree abduction and pull down. We're still going to get some scapular retraction. We're going to get a little bit of lat engagement. And then, of course, we're still going to get that core engagement because we're going to have to stabilize and hold this position. So 2 great exercises immediately that we can use to start cueing full body core engagement. By doing these exercises immediately, you can start to train that mind-muscle connection to core engagement. A lot of us, not just seniors, but a lot of us lose that mind-muscle connection of core engagement and stability, especially the more sedentary we are or the longer we go without training this in a synergistic way. When we stop doing compound movements or full body patterns that are ground-based, we start losing that core engagement. So again, this is for everyone, but specifically our seniors that perhaps have been sedentary. We want to make sure that we're engaging that core from the foundation so that we can build it up. For your more advanced client, we have partner-assisted core stabilization training. This is a great way to add that reaction component that I talked about earlier. The reaction component will really train that real-world response and train core stabilization because it's unpredictable. The core has to respond. And so by introducing instability or challenge, you develop stability. So again, that's how we get things stronger, right? We expose it to something that it cannot do, so the body has to adapt. That is training in general, isn't it? The same goes for balance and stability and core engagement. To make something better, we must expose it to a challenge. And so one great way to do that is to start challenging core stability with trainer-assisted patterns. So here is a great exercise that Mike is doing here with his client. We are in a split stance with a heavy resistance band around the waist. And simply, all Mike is doing is adding unpredictable perturbations, in other words, movements, to create a little bit of an unstable environment for the client. And again, initially, we have both feet flat on the ground, and you can see some significant movement of that front foot. You see the internal, external rotation of the hip. You see the foot moving. You see that foot inverting and everting back and forth, starting to pivot to maintain position. That is a healthy response as the body fights to maintain balance. Again, level of appropriateness. If you've ever had a webinar with me before, I will say those words at least once in every webinar. Level of appropriateness. Again, if there's instability at the knee, the hip, or the ankle, you want to progress this appropriately. But that response there, that quick reaction, is helping maintain that center of mass to prevent falling and helps engage core. You can see that Mike progresses that exercise to have his client up on her back toe. And by simply doing that, we decrease the base of support. We now make that core engagement increase even more. And again, focusing on maintaining that braced core with good posture, even though there are these perturbations that are disrupting that balance and that posture. We can also do that without a band, and we can simply do it with a stability ball. Have the client hold the stability ball out in front. And again, the further away it gets, the more difficult it gets. So again, you can start very close and then progress it by extending the arms out. And again, by adding random perturbations and cueing the client to keep that ball right in front. Don't let it rotate. No matter what I do, no matter how I hit it, keep it right in front. And here you can see Mike is just adding random perturbations, and that client is having to really engage core as well as maintain posture and balance. And again, this is a more advanced exercise, but again, you can see just how intense this simple exercise can be, but then also how vital it can be to train core engagement, because there really is no way around this exercise. By simply just resisting the perturbations, core has to engage, because if not, there's going to be rotation and there's going to be some lack of stability and probably potential fall. So this exercise, again, can be regressed. We can do something very similar. We can do something in a seated position by simply just adding these little perturbations where the core has to engage to prevent that disruption. So any way that we can add perturbation into our training, we can really enhance that core engagement. Band work is one of the best ways that we can add challenge to our training with low risk and typically a lot safer on the joints, but still adding a level of resistance. Resistance bands are a great tool to use because A, they are affordable compared to free weights. B, they are transportable. They are mobile. You can take them anywhere and they don't take up a lot of room. And then thirdly, my favorite is the variable resistance you get that actually the intensity of the exercise increases as the band stretches. So as you add distance in the band, or as you stretch the band, you add tension. So you get more tension at the end range motion of an exercise compared to free weight, where typically it's harder at the beginning and it's easier as you get to a full range of motion. With the band, it's flipped. It's usually easier as you begin, but gets more difficult at end range motion, which is a nice way to challenge tissue. Further, I love bands because of the constant tension through both concentric and eccentric actions. Unlike free weights, the band is actually going to provide tension through the, of course, concentric phase, but also eccentric. You have to resist that band from pulling that leg or that arm or that body back into that original position because of the tension in the band. Whereas free weights, you are resisting that movement, but typically it's gravity. Here you have constant tension through both phases of movement. So bands are one of my favorite go-tos, and they really are versatile if you know how to use them or how to anchor them. And so anchoring them is really important. Further, you can actually buy 2 or 3 of these monster bands, as they're called. So they're just these big long loop bands. And then you can slip knot them together to create longer bands so that you can do ambulation and core training drills. Because sometimes the bands, though, can be stretched, are a bit short. So you're limited in what you can do. You're very stationary. But by adding bands together with a basic slip knot, and then again anchoring them with either a carabiner clip or an assist strap that you can find on online stores, probably even some warehouses, that can be used indoors, or anything that can be it can be adhered to or attached to. You have a variety of different things that you can do. And so we see this video here of Guy just simply using 2 bands to create a slip knot. And so you can see here, we'll watch it a couple times. That slip knot now, it has elongated the band. We have 2 bands now together, so we have much more play with that band, which allows us to add more to our exercises. We can do ambulation drills. We can do movement drills side to side. We can walk and move the band. We can do multiple exercises to challenge the body because we're able to again, be creative and extend these bands by using a slip knot. And so here you also see Guy using the tree as an anchor by, again, adding another slip knot. So we'll watch it one more time, putting one band through, take that band through and put it through the original band that you had, tighten it up, and you have yourself a slip knot. And then again, you can wrap this around anything. In a moment, I have some pictures of just some ideas of where you can wrap this band. And again, you are only limited by your creativity. You are only limited by your creativity. Here you can see that we have anchored a band to a sign, to a door, to a fence, to a tree. Really, anything that is solid. Again, be careful. You want to make sure that you have something that is solid, that won't come unhinged, or if you're using it on a door, make sure that you do it on close to the hinges, and then further that you place a note on the other side of the door that says that do not open, because obviously you don't want that to come back and slap you or your client. But also there's another creative way that you can use this is with each other. If you're working with groups or small groups, using each other as anchors is a great way to continue challenging core during passive rest. And so obviously you see here we have a group of seniors. We have them next to the table for a couple reasons. There's that stability that in the event that they lose their balance, they can reach and touch that table to maintain balance and posture. And then again, we can progress from there where we do, a finger touch and then maybe a lift as they're doing exercises. What's great about this and working with groups is that as one person is actually performing an exercise, the other person is the anchor. Now they may be resting, but they're still engaging their core because they're having to maintain core engagement to be a good anchor for their partner. So this is a great way that you can use continual training methods to engage your clients during the entire session. Even though they're still resting, they're still actually doing something productive. They're not just resting completely passively. They're at least getting some core engagement working as an anchor for their partner. Something to consider. So looking at those bands and adding a couple exercises here, really get that core engaging, we can start with some of these anti-movements. So when I say anti-movements, what we're doing is we are putting ourselves in a position where we are resisting a specific movement. That's what the anti means. So you see here that guy has the band around his waist. If he were to walk forward and just relax, his hips would come back. They would flex. His hips would flex. He would bend over because he would not be engaging his core to maintain an upright position. So we obviously want to resist that flexion. Ergo, it's called anti-flexion. Anti-flexion. He's going to have to extend the hips, engage and brace the core to maintain this position through this exercise. So you can see here, he is here up against the tree, and then he is going to walk out. And as he's taking a step out each time, he is having to engage core and keep those hips engaged to prevent that flexion of the hip. So this is an anti-flexion exercise, specifically hip, because the band is at the hip. The next one is the opposite. It is anti-extension. Well, why? The band is now high, and again, as guy walks out, if he were to just relax, his trunk would extend. So this is anti-extension because guy is going to engage his core to maintain the appropriate posture as he takes a step out. So again, this is another great way to get the body to automatically engage core by adding this element of challenge and this element of resistance. And so here you can see guy, as he takes a step out, he is going to resist that extension. Take a step back, and again, just maintaining that good core engagement and resisting that extension back. Similarly, like the last ones, we are placing the band to resist a movement. So the band is again around guy's hips, but now the band would be pulling his hips forward, which would be extension. So to prevent that excessive extension, he has to resist it. So it's anti-extension by maintaining, again, a braced core and a slightly flexed position as he steps backwards. So again, he's obviously going to extend, but we're resisting that extensive extension from the band. And so here we're just going to simply see the guy as he takes his step back, and he is resisting that band from pulling the hips forward first. You notice that his posture is stacked as he is stepping, and so he is controlling the movement even though the band is pulling him. The next one is anti-flexion. So again, very similarly to the other ones, it is again up top. And again, if he were to relax, the band would pull him forward. And so by engaging that posterior chain, keeping a tight braced core, he's able to maintain core engagement as he is stepping. And the band is creating an environment where the body automatically challenges the core. Because if not, he's going to lose position and then possibly lose balance. So this band is just adding resistance that will automatically get that core to engage. And of course, what we would be cueing is good posture. And then of course, as we step, maintaining that posture, controlling the step forward and backwards so that we maintain good balance, good core engagement. We can also do this laterally, lateral flexion. So anti-lateral flexion, very similar. We take steps out while maintaining that neutral spine, not allowing the band to pull us into that laterally flexed position. So again, anti-lateral flexion, because the band is pulling, we are resisting that by engaging the core. Again, I love these exercises because the band does the work for you. It creates an environment where the body has to adjust in order to execute the pattern. So for a guy to actually step sideways with an upright posture, he has to brace his core and engage his core, or the band is going to pull him in that lateral flexion. So I love these bands and how these bands can actually do the work for you. In other words, they will create an environment where the body naturally has to naturally has to brace the core and engage the core. We can add a little bit more to it by adding a pressing pattern. And one of the best pressing patterns with this anti-rotation is the Pallof press. And so anytime we take that band off of the center of the body and we put it away from the body, we are going to create rotation, right? So the band and all the other ones were actually attached to Guy. And so as he's stepping, he was creating an environment that forced muscles to engage. Now we're looking at rotation by taking the band off the person and now pulling it away. And so now we have an anchor point, the hands, away from an axis of rotation, which would be the core and the trunk. Now there's going to be a rotational component. And so now what we're simply doing is we are adding this pattern to resist the rotation. So it is a press. It is a press, but Guy has to resist the rotation of the band pulling him. So now, not only are we going to be working the upper body just a little bit, we are focused more so on resisting that rotation and getting that core engaged. So that's a huge benefit of the Pallof press. And there are several variations that you can do. Again, you're limited by your creativity and of course, level of appropriateness for your client. As always, you can always regress these to a seated position and still merit a lot of benefits from this position and from these exercises. So yes, we are showing them from a standing position, which would be ideal because we are getting ground-based work. We're getting full body synergistic force transfer through the body. We're getting core from foot to head. But again, it can be regressed for your client. We have that foundation now of core. That has to be the foundation that we establish because from there we can then build upon it. When we start talking about exercise recommendations for seniors, they fall in line with many of the recommendations that we see from American College of Sports Medicine or National Academy of Sports Medicine. Any of those organizations, they give us a lot of great recommendations looking at minimum of 2 times a week, hitting all muscle groups, typically 1 to 3 sets per muscle group with 8 to 12 repetitions per set, and try to minimize rest time between sets to about 30 to 60 seconds, and then maximize rest time between sessions at about 48 to 96 hours for those muscle groups to allow for recovery. And again, these are guidelines and baseline numbers. So based on your client, you may need to modify these as needed. Some suggestions that we want to consider for our senior strength training programs. Again, by no means are these set in stone. These are just guidelines. So first, limit or eliminate, if appropriate, floor-based core training. Now, there is some floor-based core training where we are helping our seniors build up the strength and the patterns to get up after a fall. That's a little bit different than the traditional floor-based training of down on the ground to do crunches, up to do something else, back down on the ground to do some other abdominal exercise or plank exercise, back up. That up and down could be difficult, specifically for our seniors. So unless we're doing a specific floor-based training where we are teaching the patterns to get up after a fall or to build the strength up of the core and the coordination of the upper and lower body to get oneself up after a fall, maybe limit the floor-based exercises. Further, arms above shoulder height. Many of our seniors have shoulder problems, with many getting shoulder replacement surgeries. And again, obviously, level of appropriateness, but keeping those arms at shoulder height or below is probably advisable. Limit the single joint exercises. There is a time and a place for single joint exercises. I am not a fan of villainizing any exercise. I don't think any exercise is inherently bad per se. I just think it may be inappropriate for certain people at certain times in their journey. We always have to think about function and what is functional for that individual. Single joint are great. They are great for isolating to a degree or targeting specific muscles. So if we have some significant muscle atrophy or some muscle weakness, some single joint exercises are great. But when we start looking at activities of daily living, very rarely are we in isolation. Our bodies work synergistically, so looking more at those compound movements would probably be more advisable. Further, along those same lines, machine strength training, again, time and place for using machines for certain exercises, no doubt. But the machine typically provides the stability, whether you're probably seated in a machine, you're strapped to a machine, or you're in a position where only one body part is moving. Again, time and a place for that. But when we start looking at activities of daily living and then functional daily life, we establish the stability in our environment via our core. In other words, as we're standing, as we're walking, as we're moving, we are interacting with the ground in our environment. We are providing that stability. And so trying to find ways to create more core engagement, more ground-based exercises, if possible, would probably be more advisable compared to machine strength training. Maybe some things to emphasize. Vertical core and balance training. In other words, standing positions, as we've shown with already a few exercises. Again, we're utilizing more of the ground reaction forces, but we're also getting more full body contribution to core engagement and control. Functional pulls and pushes. We pull and push all day. Those are functional things that we do in our daily life. So reinforcing those patterns could be very, very helpful. Integrated multi-joint training, kind of mentioned that earlier when we talked about that single joint exercise. Multi-joint can be extremely beneficial. Exercises utilizing body weight, free weights, or elastic resistance. Again, compared to the machine, again, a lot more joint stability, joint integrity needed for body weight, free weight, and elastic training compared to a machine. So again, if we can introduce a little bit of that instability, we can create adaptation within the body and help strengthen those joints. Emphasize stretching chronically, tight muscles. When we start getting these tight, chronic, hypertonic positions, the tissue will adapt to that position, and then we start to see poor postures. We start to see muscle imbalances, and those are things that sometimes can be alleviated with stretching. So we want to make sure that we're encouraging stretching of some of those chronically tight areas. Finally, the added benefit is that you now have a program that you can do anywhere with very minimal equipment. When we're looking at body weight, or even band-based exercises, you don't need a full facility. Those are obviously great if you have access to them, but you're not limited to just that. Before we get into the strength exercises, I want to briefly talk about bracing. I brought it up a little bit, but I want to talk about what bracing really is. Bracing is not sucking in. That's the hollow maneuver. Hollow maneuver is good possibly from a teaching perspective, maybe to improve that mind-muscle connection, that neuromuscular control of engagement. But holding a hollowed position while we're moving actually will put us in a compromised position, even might possibly compromise the lower back. A brace position is about stiffness. It's about creating tension through the core to protect that neutral spine. And one of the best ways to do that is with our breathing. As we inhale, using our diaphragm, as we exhale, we naturally have this bearing down effect. We're not bearing down as if we're using the restroom, but we are compressing. We are compressing down and creating tension around our trunk and our core. We're not sucking in, we're creating tension. And one of the best ways to do that is something called the belly slap. Belly slap, you just slap your belly. If you're not creating tension, it's going to have that hollow effect. It's going to feel soft. But when we engage and we brace, we have less impact from that belly tap. So it's a nice little way to test is if we tap our belly and we're tense and we have that tension that surrounds front to back, then we're in that brace position. It's not just our abs, it's creating tension all the way around. And so practicing this technique can be very beneficial. And one of the best ways to teach it, like I said, is with breathing. And as we exhale, breathe and stay tense, but still in control. And then of course that belly tap. Again, the degree of that intensity or that tension is based on what you're doing, right? So right now I am braced because I've practiced this, but I am not at a high level of intensity because I'm not under a lot of load. But obviously if I were to lift something very heavy, that brace would get even more intense to support myself. So again, training that as we move helps with stability, but also protection of that neutral spine as we go through movement. So one of the first things that we can do to integrate strength training into our activities of daily living is to do one of the most common ones, which is ambulation, walking. And we can take walking to the next level by adding some resistance with a resistance band. We know that walking is obviously one of the best things that we can do for our health and for longevity, as well as a great way to engage in cardiovascular training. But we can focus on the strength training component of walking by going through a resisted gait cycle or stride. You can see here that Guy does have his band around his waist and he is striding out. What this is really focusing on is that extension phase. So actually that resistance is pulling him, and so he's really going to be focusing on that posterior chain of extension through the hips. As he steps out, it gets more challenging, so he's focusing on good strides, but then he's also controlling it on the way back. Very important here. We can then take it to the next level and reverse it and focus more on that anterior chain, that extension of the knee as we step backwards, because this is obviously wanting to pull us forward. So to continue moving back, we're going to have to push off the front of that foot and extend the knee. So this is a great way to not only challenge these muscles that we're trying to work from a strength training perspective, but it also, as always, because we have this off-center force, this tension pulling us, we are getting core engagement as well. As you can see, the bands are always challenging core, specifically when we're in this ground-based position, the standing position. Rotation is a critical component to movement. We rotate all the time. And when we think of rotation in an exercise perspective, we kind of think about exercises that are with medicine balls, things like that. But we got to think about rotation occurs all the time. We are turning and rotating everything from the cervical all the way down to our trunk and our hips. When we look at rotation, rotation is actually just like we've been talking, synergistic approach that we can do isolated rotation. I can rotate just my cervical region. I can rotate just my T-spine. I can rotate just my hips. But each of those have their limitations until we add all of them together. So with the cervical, the thoracic, and the trunk and the hips, I'm able to get turned around, but that's only the upper body. And we are not looking at the contributions of the lower body. When we start talking about rotation as a full body pattern, we get contributions from our legs and our foot as they pivot on the ground. As you can see in the picture here, I am rotating to my right. I am rotating to my right. So to do that, of course, my cervical spine and my T-spine and my hips are going to rotate to the right. But in order to get that full rotation, to get better transition of force from the ground through my body, I need to get my lower body engaged in that. So my left knee will actually flex. That flexion is going to open up the hips even more and allow me to pivot on my left foot. That pivot is going to allow me to completely open up and rotate. Teaching this rotational pattern is extremely helpful because it also helps us not only engage all the muscles and transfer force through our body, but maintain stability in these positions and make sure that we have adequate range of motion. If I cannot rotate my T-spine at all, and I start to fall in this direction, I may not be able to counter that pattern. Being able to rotate and get in these positions may help me control my movement. And so when we're looking at training or teaching rotation, obviously we want to go through the entire body, but really we want to look at the T-spine, thoracic spine, and the hips and make sure those are working in a strong way so that we can support movement. Some great exercises to start getting rotational patterns down is some resisted rotation. So now it's not anti-rotation, we are actually resisting rotation, getting those muscles challenged. So you can see Guy is going through that rotational pattern that I just talked about. He is rotating to his left, which means his right knee is flexing and his right foot is pivoting. This is one of the best exercises that we can do just to start reinforcing and challenging rotation. And again, with that band, we're going to have tension through both concentric and eccentric phases. So as we rotate back, we have to control that movement, which is extremely important. Diving into pushes and pulls. So we've talked about the core, we've talked about rotation. Now we're starting to look at some of these muscle groups that perform some of these patterns that we do every day with our activities of daily living, pushing and pulling. When we start looking at the major muscles, we know that we've got, as we push, a lot of the pectoralis muscles, the anterior deltoid, triceps of the upper arm. And as we pull, we're looking opposite. We're looking at the latissimus dorsi. We're looking at the medial lower traps, the rhomboids that all help with stabilizing the scapula, but also retracting the scapula. That movement of push and pull is extremely beneficial. Further, it helps engage core, but also helps us accomplish bigger patterns. If we are arm dominant, we are going to be limited in our strength and what we are able to do from an independence standpoint. These bigger muscles are beneficial if we can get them to do their job. So thinking of things like vacuuming. If we vacuum with just our arm, we can fatigue very quickly. We also have a limited range of motion versus pushing and pulling with the pectoral and shoulder girdle and getting better range of motion and getting more force transfer. It allows us to do more. So when you start looking at some of the ways that we can engage these muscles, again, looking at the bands, we have some great ways to challenge these patterns. The first one is a lat sweep. Lat sweep is a great way to get those lats engaged in a little bit more of an isolated way because of the pattern of the arm, but still again engaging core because we're in this standing upright position. With the lat sweep, using the band is a great way because you can actually get into some little bit of hyper extension, which is really going to get those lats engaged. With a high anchor, we're going to pull the arms straight down and back. The goal is to keep those elbows in a fixed position. We don't want to have the elbows flexing and then extending, elbow flexing and extending, because that's going to get more of the biceps and triceps into it. We want to actually have that in a pretty fixed position, and we're going to extend at the shoulder and go through that full extension. Using the band is great because you, like I said earlier, you can get into kind of hyperextension versus a bar. If you're using a bar and a cable, great exercise, but you're limited. You're going to hit your thighs and you can't get to that full extension. This is a great way to get that latissimus dorsi really engaged because as we do a row, in a minute we'll see, we do get some lat, but we're going to get a lot more trap engagement. So if we're really trying to target those lats, having that just extension of the arm is going to really isolate the lats a bit more. The next one here is a upright row. And upright row, again, gets a little bit of heat because of some possible contraindications, but it's all about, again, level of appropriateness for your client and how you execute. An upright row is an activity of daily living. Many of us will do this pattern where we are going to lift our arm up, and we're also going to have a bit of external rotation. Let me give you a few examples if you're not quite buying into the fact that we do this upright row pattern. If you need to put on a jacket with a zipper, the way you're going to do that is you're going to pull that up. We're going to come up with our arm. We're going to abduct. We're also going to slightly horizontally abduct and, of course, externally rotate. This is a pattern that we do. Again, does it need to be excessively loaded? Arguably not. But should we reinforce this pattern in some way? Arguably yes. Another good example, which is very functional. Have you ever had to pull a trash bag out of a trash can? Do you stand up next to it sideways in a split stance and do a row to pull it up? Most likely not. Most of the time you need two hands, and you're going to stand on it and you're going to pull that baby straight up. Again, that is a functional activity that we do that, again, should be reinforced so that we prevent injuries. By loading it slightly, we help strengthen and improve the integrity. One more, if you're not quite sold yet, is that if any of you have long hair. I have long hair. In order to put my hair up, I have to externally rotate my shoulders and bring them up into this position. If you don't have long hair and you wash your hair or your head, same thing, you will put shampoo in your hand and you will come into this externally rotated position. Again, do we need to load these excessively? Perhaps not. But should we challenge these patterns so that our bodies can adapt to these positions and maintain integrity? I would argue yes. And so using a band is a great way to do it because you have that lighter resistance, still be challenging, but it's all about control. It's all about control, and you can reposition the hands to make it more appropriate for your client. Obviously, the more narrow our hands, that can create excessive torque at the shoulders and possibly the elbow or wrist. So modify that a bit. Maybe we bring the hands out just a little bit. The goal here, though, is focusing that we're not just bringing the hands up, that we bring the elbows up. And as we bring the elbows up, the hands are always slightly lower than the elbows. We never bring them all the way up and rotate. We just keep those elbows slightly above, and we will still challenge those muscles and those patterns. Looking at row patterns and push patterns. So when we look at a horizontal row meaning that we are pulling the band and it's horizontal, we are focusing more here on that retraction of the scapula compared to the lat sweep. With that retraction, we're getting a lot of the middle trapezius and those rhomboids, which are extremely helpful at bringing those shoulders to that full range of motion. We want to make sure that we're cueing scapular retraction the right way, because too many clients use just their arms. They become more bicep dominant. And again, we may be in these bad postures with these row patterns. We become almost completely arm dominant. So we want to focus on good posture and being able to retract the scapula. Of course, we are going to get some lat work just because of the natural extension there of the shoulder. But again, cueing this movement the right way is what will help you engage not just the lats, but the traps appropriately. Pressing, again, another great way to hit the pectoralis muscle, also the deltoids. And again, because we're in that standing position, we're also getting a lot of core work. The band is wanting to pull us into that extension, so we are bracing ourselves so that we can stay in this upright position as we press. Couple things to think about here, and I waited until now to talk about it because this is the first time that we saw some kind of interaction with the band. You notice Guy here has the band underneath his arms. Having the band rub on the skin may not be appropriate for our senior population. Many of our seniors may be on a blood thinner, and this could create a small laceration. There might be more blood than normal. It could also create bruising, very easy bruising, especially for some of our seniors. And so we want to make sure that we're not using the band in a way that would create discomfort on the skin. There are a couple ways around this. Number one is to wear clothing that would prevent the band from actually interacting or touching the skin, number one. Number two, as we see here, probably the easiest is reposition the bands so that the bands don't actually touch anything other than the hands. If even holding the band if it's bands that don't have handles, if even holding the bands without some type of handle is difficult, you can wrap it with a towel, or as Guy had pointed out, and I got to give him credit for this, you can go get insulation from a hardware store, insulation that would go around copper piping. It's already pre-cut. It's about 1 inch in diameter, 2 inches in diameter, and you can cut that, very affordable. You can use that as a handle. You slip the band right in between there and you never have to actually touch the band. So giving Guy credit there, that was a great idea there. But that's another way that we can do this. So keep that in mind when you're working with your clients so that we don't have the uncomfortability of that band rubbing on the skin. Of course, we can change position to change how the muscle engages. And so this first one here is a fly. And so flies typically can be limiting because with a fly with dumbbells, we are typically lying horizontally in that supine position. And as we start to fly, we put a lot of stress on that shoulder. Further, if we use a machine like a pec deck, we're going to be limited in that range of motion. With a band, specifically unilaterally, single arm band, we can get full range of motion and get that full contraction of the pectoralis tissue as we go through this range of motion. And again, by simply just changing the position of the body, we don't even have to touch the band. The band wouldn't even touch our arm, and we can still get this full range of motion. Again, we're in a standing position, so we're getting that core engagement. A decline press is another great way to hit those costal and rib area of the pectoralis muscle because of the angle at which we're pressing. So again, you can see here that I have a high anchor, and again, the band is coming underneath my arm. I have a neutral position with a neutral head, and I am pressing down. And that is going to work those lower fibers of the pectoralis major. These muscles sometimes get neglected because we don't think about those movements. But again, we can always modify this as well. We could actually lower the anchor and we could press up. And by pressing up, we're going to hit more of the clavicular area of the pectoralis major and of course get a little bit more of that anterior deltoid into it as well. So again, we can modify the position to challenge muscle differently. And that's what I like about the bands is that it's so easy to modify the position. I don't have to get on a new machine. We don't have to really swap anything out. All we need to do is change that anchor point. And so this is another great exercise to hit those pectoralis muscles and some deltoid muscles to emphasize the push pattern. Our arms are important. We typically see them from more of an isolated perspective, but our arm and our arm weakness can lead to a decrease in our activities of daily living. So there are a couple things that we want to do here that we can train and challenge these muscles in a different way. So this first one is a little bit different. This is an incline bicep curl. So it mimics that incline position seated because as you're seated on an incline, you are back and the elbow is going, the shoulder is going to extend a little bit. It's going to put a lot of stress specifically on that long head of the bicep because it does attach into the shoulder. And so by extending, we're going to put a lot of stress on that. This mimics that pattern by simply extending the shoulder and then curling up. So if you have a client that does have weaker shoulders or injured shoulder, this may not be the best exercise for them to do, only because it is going to stress that long head of the bicep. So again, there's pros and cons to this because you can really get a good stretch and a good range of motion. But again, if that stretch is causing discomfort or pain, you may want to do this next one. And this next one is called carrying angle curl. Carrying angle is the angle that our arms are in that natural anatomical position. If you were to just stand, put your arms straight down and take a look at those, you're going to see that your elbows bend out. We don't really use that word. It's not an anatomically correct term, but it does give you that visual that the elbows your arms aren't just completely straight. There's a slight bend to them. They almost curve outward. That's the carrying angle. It's a natural angle for all of us. What we're doing with this exercise is following that natural pattern. So wherever that natural angle is, we are just going to bring the arm up into that pattern. The next one is a resisted push-up. But again, we're still in that vertical position. So we're doing a band wall push-up. Band wall push-up just takes a wall push-up and adds some resistance. So you can see the setup here. I have the band around my upper back. And again, it is on my shirt, so it's not interacting with my skin. I'm simply going to hold that band, and I am going to get in a position up on the wall, and I'm going to do a push-up. And so you can see here, I am focusing on good range of motion. I am focusing on pressing away and keeping that core nice and engaged. You can see that the band does touch my arm a little bit at the end. Another variation of this is to bring the band underneath the arm. The only problem with that is that the band has to be held with the thumb. So if you have an individual that has weaker thumbs or weaker wrists, you may want to do the version that I am demonstrating here. So again, great exercise to challenge a natural primal pattern, the push-up pattern, and add resistance, but still in that vertical position. Of course, working the back of the arm is very important. We use the triceps not just in front of us, but to push ourselves up, right? So sitting down and pushing ourselves up, sometimes we use our triceps. So challenging the biceps is a really great way to, really great exercise to add. Here, this is just a basic band. I have a high anchor. I'm just focusing on that full range of motion. Again, fairly simple, fairly straightforward, but again, essential for engaging tricep extension and challenging those muscles in what we do every day with our activities of daily living. Another great way to add that is to add it into kind of that functional activity of daily living by doing a dip. Like when we push ourselves up out of a chair, we use the tricep muscles. This is a great way to do it. So this first one is the more advanced one. I'm showing it first on purpose because it does give you greater range of motion. I can even progress this even more by extending the knees and getting even more range of motion. So this puts a lot of stress and emphasis on the triceps. However, again, level of appropriateness. What does this do to the anterior aspect of my shoulder? It puts a lot of stress on it. It puts me into a deep stretch of that anterior capsule. Again, when we are in a deeper position and we need to get ourselves up, obviously it can be very beneficial and helpful. But if we have a client that does have an injured shoulder or does not have the range of motion, this could be uncomfortable. So what's an easy variation is to do a chair dip. And again, this really mimics that activity of daily living of getting up out of a chair or standing up off the toilet. If you have a chair that has armrests, this is a great way to actually do a dip. Not only do you have a little bit of trunk flexion that will take the stress off of the anterior deltoid, but it also does mimic that pattern of standing up. So you can use legs a little bit to actually start initiating this movement. We mentioned earlier about scapular retraction, and retraction is so important. And again, we've talked about some big movement patterns, and we talk about retraction, protraction. It's by itself not necessarily a functional movement, but what it does is it helps us develop the functional movements even better. And I mentioned this earlier by being arm dominant. If we don't have protraction, retraction, we have limited engagement of these bigger muscles like the pecs, the delts, and the lats and the traps. By retracting and protracting, we get more contribution from those muscles. When we don't, we become more arm dominant and then we decrease our strength potential. If we look at retraction and we just watch the retraction by itself and we see that movement initiating from the elbow, very, very common that we're probably bicep dominant, that the elbow flexors are controlling retraction versus retraction itself. Typically, overly strong upper traps and levator scapula may also dominate and result in scapula elevation, not retraction. So again, talking about retraction, pinching the shoulder blades together. If your client comes up with it, Typically that means that we have some dominant upper traps, levators, and then our rhomboid middle traps aren't doing their job to retract. And so that's something we want to do. We want to evaluate that and assess that by looking at and observing those patterns, right? So looking at guy perform this retraction, you see that the elbows are staying fixed. He's not pulling with his arms. The movement is coming back with the shoulders, And this is a great exercise that we can just simply add, is just retractions. Can we control this movement? Can we retract, straight back, and pinch? Good, nice visual is, again, to think about pinching the shoulder blades together and using some kinesthetic or tactile feedback, simply placing your finger or your hand in the center of their back and telling your client to pinch your finger is a great way to really cue that movement using some of that kinesthetic feedback. All right, moving on down to the lower body here. Hip abduction is extremely important. Hip abduction helps with stabilizing the pelvis, specifically during single leg activity. And when we talk about single leg activity, anytime we take a step, we are balancing single leg. The gluteus medius, specifically, one of the major hip abductors, along with the other glutes, the whole glute complex, is essential at stabilizing the pelvis in that single leg position. So we want to make sure that we are tapping into the right musculature. We have a lot of muscles that do abduct. Obviously, I talked about the gluteus medius, but we also have the minimus and the maximus. So the gluteal complex are all abductors, but we also got some help from the tensor fascia lata. So TFL will contribute to some abduction. We want to be careful of what muscles we are targeting to execute hip abduction. So as I said here, when we are abducting, we are getting a ton of the glute. So you take a look in a anatomical position, so standing position, the glute medius, glute minimus are really, really involved. I already talked about stabilization, but when we talk about abduction in that upright position, we're getting 60% glute med contributing with about 30% glute minimus and about 10% TFL. Glute max is a small contributor to that just because of the placement of it, but really the focus is glute med and minimus with the TFL giving about 10%. But when we abduct our hips, it changes the position a bit and it puts a significant amount of stress on the TFL to abduct. Now, if that is your goal, fine, but a lot of times that TFL can get overworked. It can become hypertonic and tight and could result in something called TFL syndrome. But really what it is it's going to be overdeveloped and can create tension and discomfort in that area. And so we want to make sure that we are targeting the right hip abductors. And so try, if possible, to do hip abduction in a standing position. If we have to stabilize the position, as we see here, that's fine. As long as we, again, are in this more neutral position to really get the glute med and minimus firing. So we can see mini band hip abduction here. So we have a mini band at right below the knees. And right below the knees is a great place to have it. So obviously the axis of rotation is the hip. So as the band gets closer to the hips, or that axis of rotation, the easier it will be. The further it gets, the more difficult it will be. So if we put it around our mid-thighs, it will be somewhat challenging. If we put it right at the knee, above the knees, more challenging. Below the knees, a little bit more challenging. At the ankles, very challenging. Something to consider, though, is that we have pivot points or joints. So if we have the band at the ankles, we have the knee, which could interfere with that range of motion. If I flex the knee too much, it may take away a bit of that tension that I want to go to the hip. So you may want to consider the band placement. I think right above or below the knee is a great place because it's mostly the femur that is moving, very little knee contribution, very little tibia and knee and ankle contribution. So I think that's a great place for it. And then from there, what we're simply doing is we are going to abduct the leg out. You notice here, guy is using just a stick to balance. Of course, you could use anything to help with stability. It could be a table, a chair, you as the trainer. One thing you notice that he's doing here that I think is really good to point out is that he's not leaning over into it. So as he abducts, he's not moving his trunk. A lot of people will do that to bail out their hip abductors. The glute medius tends to not want to be engaged, especially if we have not been engaging it. If we have some hip instability, the glute medius will not want to do its job. And by leaning over, we're starting to use our trunk so that we don't have to get that range of motion and get that glute med firing. So make sure we have a good upright posture. Cue that posture as we abduct. From there, we can add movement. So now there's a little bit more of a dynamic component here. So what we're doing here is a side shuffle for abduction. The focus here is that we're not hip hinging though. We are focusing on that step. There are 3 different mini band drills that we can do. The first is just lateral walking with the bands around the feet, and then compare it to around the ankles. And the feet, you'll notice, will typically help your hips engage more. That's one way to do it. Number 2, with the bands around the knees, try forward and backward walking. Forward and backward walking. Make sure that the knees stay apart and the feet point forward. We don't want to see that valgus effect coming forward. We want to actually control that movement forward and back with the hips. Thirdly, try a crossover step. Try a crossover step. And this would look like walking that grapevine, so that over in front as you step. Those are some variations. Here we're just going to see that lateral walking. You see that we have a nice lateral step that we're not hinged over, we're not bent over, we're staying up in that neutral position, and we're controlling that movement with that hip abduction. Notice that the knees are not caving in. We notice that the feet aren't turning. So we're really focusing on stepping out. Further, the trail leg is not just slapping through, right? Because the band is there, it's going to want to pull that leg in. We are controlling both steps. Both steps, very important there. I want to take a moment real quick to talk about the piriformis, only because it is a unique muscle that does a couple of different things, and we want to make sure that we are challenging the right muscle with the right patterns. We talk about the piriformis. Piriformis is a unique muscle in anatomical position, so standing position. It goes from the sacrum to the greater trochanter of the femur, and it is a hip external rotator. It's a big muscle. It does have a lot of popularity because of its location and relative specifically to the sciatic nerve. Sciatic nerve can run underneath it, on top of it, or even through the piriformis. So if we have tight piriformis, it can compress that sciatic nerve and cause pain that is sometimes self-diagnosed as sciatica, when in all actuality it's just tight piriformis that is compressing on that nerve. So that's important. That's an important thing to think about. But number 2 is that the piriformis actually changes its function based on our position. So as I start to flex the hip, that muscle is going to change its position. And because I have a flexed hip, it actually becomes an internal rotator. It's going to rotate the femur medially. And so based on our position, the piriformis does 2 different things. At 90 degrees of hip flexion, again, that piriformis becomes a medial rotator. So why did I bring this up? Well, it's all about the exercise. There are 2 really popular exercises that people lump into the same pattern: clamshells and abduction, and they are not the same. And I want to make sure that we understand that. The abduction sees that movement at the hip. We don't have rotation because we don't have a fixed point. The only fixed point is the hip, and we see that movement, that arc movement, versus a clamshell where the feet and the hip stay put, and we start to see rotation. So when you start to look at these 2 movements, you now start to see a bit of a difference. So when we start to see the abduction here, so this is line abduction, just to show you, we have 1 point of movement, 1 point of contact there, that axis of rotation at the hip, and the leg has this nice arc, right? Because the entire leg is moving, there's abduction. When we look at a clamshell, the hip and the feet both have a point of contact. In other words, the feet are a pivot point and the hip is a pivot point. So we are actually getting rotation. We are actually getting rotation with this pattern. So it's not the same as hip abduction. So just recognize that when we're externally rotating or when we're in a clamshell, we're actually doing external rotation here. When we are in a neutral position, so leg straight, we are abducting. So just want to point that out. The next exercise is one of the best because it is one of the most prominent ADLs that we have, and that is the squat pattern. Now, when we hear the squat, we automatically go to the fitness setting and we think about a barbell or a back-loaded squat. But when we talk about the squat, it encompasses the entire continuum of that pattern, meaning, yes, it could be a heavy barbell loaded squat or the ability to stand up and sit down, a sit to stand simply, which is a major contributor to independence. Again, I said this earlier, but the squat pattern is something that we do every single day, whether we're sitting or we're using the restroom. It is one of the best overall exercises for full and balanced development of the lower body. It's one of the best exercises for training transfer of power from the legs through the core. Finally, it's often regarded as one of the most functional senior exercises. And we start looking at the squat, we know that it is it's a combination of the lower body muscles, of course, transferring to the trunk, a lot of quadricep, a lot of glute, a lot of hamstring action. But again, how we execute that pattern kind of depends on how much, but we definitely know we want all of those muscles contributing. We don't want it to be just quad dominant. We don't want it to be just glute dominant. We want to have good synergistic contribution into the hips through the trunk as we stand up into that squat pattern. A couple things I want to talk about with the squat that I think is very often overlooked. And so the very first thing that I want to talk about is the squat pattern itself. We get very fixated on the perfect pattern. The perfect pattern is really relative. It's based on the individual because there are things that we need to consider other than just range of motion. Of course, there are limitations with muscle strength, muscle range of motion, but also anthropometry is one of those things. Looking at individuals' height, looking at their limb lengths compared to their trunk length may determine the best pattern that they have for squatting. We get very, for a long time, the fitness industry got very focused on this perfect position, right? Shoulder width apart. Every single person squats the same way no matter what. And if you can't do it, you're bad at squatting. And we're starting to see more literature supporting the changes in patterns based on anthropometry. And so typically people that have long legs with a shorter torso are going to squat differently than somebody with a more balanced trunk and torso. And that goes to the very, very first rule, and really the most basic physics component of squatting is that your center of mass will stay over the center of your foot when you squat. And as simple as that is, it makes a lot of sense. If your center of mass, or the center of your load, if you're doing a loaded squat, must stay over the middle of your foot, or you will fall. So if I tip too far forward when I squat and come up on my toes, I am going to fall forward when I squat. If I sit back into my squat too much and all of my center of mass moves posteriorly and my toes lift up off the ground, I'm going to fall back. So to stay balanced, I'm going to have to keep my center of mass over my foot. That's where that anthropometry comes in. If people have longer legs, there's nowhere for their femurs to go. They can obviously dorsiflex a whole lot more, but they're going to have to flex more at the trunk to maintain that center of mass. Again, we're talking generalities here. Of course, there are limitations with muscle length and with hyper or hypotonic tissue. I totally understand that, but we still need to recognize that everyone's squat pattern might differ a bit based on these things. And we as fitness professionals need to kind of evaluate that. What is going to be the most advantageous for our clients? How are we going to help them move the best? That's really the big underlying question. So recognizing that some people may have a little more trunk flexion than others is okay, as long as we stay in that neutral position that I introduced at the very beginning of this webinar. Again, just because somebody may be having more flexion doesn't mean that we have movement at the spine. Those are two different things. We still want stability and neutrality at the spine, regardless of that position. So that's the first thing. The second thing we need to recognize is how we create leverage with the squat. If you can, if you're seated right now, I can't quite demonstrate it here, but what I'd like you to do is sit down on the edge of your chair, and I want you to walk your feet up so that your knees are 90 degrees. 90 degrees. From that point, I want you to sit upright with that neutral spine that we talked about. So you should be straight back, legs parallel to the ground, 90 degrees at the knees, straight, and your feet and your tibias vertical to the ground. And I'm going to ask you to stand up. Now, if you did, most likely the only way you could stand up is one of two ways. To actually create momentum with your trunk by flexing the trunk forward or bringing your arms forward, or you simply just flexed at the trunk, redistributed your weight over the front of your foot in order to stand up. Very few people can stay in this upright, in that position that I described, and stand straight up. Unless you have extremely strong knee extensors to carry you the whole way, you had to reposition and leverage yourself. Now, if you're seated, I'd like you to repeat the same thing, but this time set at the edge of your chair. And I simply just want you to bring your feet back. Your feet back so that you obviously are flexing the knees, so that your feet are closer to the base of the chair, the legs of the chair. And then from that position, with your feet back, slightly bend forward just a little bit, and then stand up. You probably stood up fairly easily because you created leverage. Your center of mass was over your foot, and you got great contribution from both your knees and your hips, and that allowed you to stand up easier. That's something we need to consider. Obviously, to what degree and what kind of angle we need and how much do we allow those knees to kind of move forward is up to you as a fitness professional and your client's abilities. But I bring that up to show you that that is a functional pattern, and that's actually what we're going to be doing when we're getting up from a sit to stand, specifically like on the toilet. And so we want to mimic these patterns and make sure that we're able to create patterns that reinforce their natural movement. So taking a look here, one way we can do this is with a squat matrix on the chair. And so you see a guy here sitting in that position that I talked about earlier here. And so what we're going to simply do here is, you can see him demonstrate, in order to get up, he has to create that momentum by flexing the trunk. By flexing the trunk forward, he puts his center of mass over the center of his foot and is able to stand up. So that obviously is a way that we can train the squat pattern with our knees at 90 degrees, with less focus or less shear force on the knees, because we're keeping that 90 degree bend 90 degree flexion as we sit and stand. We could also move the feet back and maintain a little bit of a trunk flexion and then come straight up and down. Obviously a little bit more on the knees, but we're also going to get good contribution from the hips and the glutes. So wanted to just demonstrate that there are different ways to modify this exercise to train the muscles a little bit differently, but then also to leverage that position. Another great modification is the half or the potty squat. So you can see a guy here, what he's going to do here is he is going to assume that position of trunk flexion. Again, I brought it up earlier, gave you the visual of how we stand up, sit down on the toilet. Perfect example, we stay in that trunk flexed position, and that allows us to train that pattern much like we would use in an activity of daily living, but that is much more advantageous to that natural squat pattern. We can always change how we distribute that weight by taking our body mass and our position over our foot kind of out of it. The way we do that is with a Swiss ball or a stability ball on the wall. Many of you have done wall squats before with a ball. couple ways that we can do this. There's two variations that I want to show here. So the first one here is going to be about feet under the hips, and the ball is high on the back, as you can see. So the one to the far left here. This is really good for squat re-education because it helps sustain the weight over the base of support while providing support against falling backwards. So you're going to see, because it's high back, my knees are going to track forward a little bit over my toes, which is very similar to what we just saw with that half potty squat. The second one you see is a low back. The ball is low on my back. And this is better because I can actually get to parallel. I can get actually fairly deep. You'll notice that there's very little movement of my knee forward. It stays fairly, my shin stays very vertical. So this is actually going to get a lot more glute engagement. This is going to engage hip extensors, so not just glutes, but also hamstrings. So take a look at them. So the first one here is that high back, and you can see that my knees are going to come slightly forward. I can't go as deep because obviously the ball will roll off my head. This is really going to focus kind of that, like I said earlier, that kind of half potty position. We're getting a lot of quad work here because the knees are coming forward, and that helps retrain that natural squat pattern. The next one here is the low back. And you can see because the ball is lower, I can drop a lot deeper. You notice that my shins stay almost vertical, which allows me to get to parallel and a little bit deeper, which is going to put a lot of emphasis, of course, because I am leaning back on the ball, a lot of emphasis there on that posterior chain. And I'm going to be able to train kind of that balance between the quadriceps and the hamstring and the glute complex. Another fun variation is a suspender squat. Suspender squat is going to add resistance through a squat using bands. So I am forced to actually do my squat pattern because I'm not using it. I'm not leaning up against the wall. I'm not using anything as stability. But the bands, as we've discussed, get more difficult with tension. So actually, as I squat down, it gets easier because there's less tension in the band. As I stand up and get to that terminal knee extension and stand all the way up, I'm actually going to have the most tension, which is flipped. Most of the time the squat gets harder as you get down lower and easier as you come up. This flips it, which can be very beneficial. Can really work some of those muscles that we have weakness at that transition point. Further, it's easier when the lower you get. So that could be beneficial for our seniors, that if they are getting lower, it's a little bit easier for them to get out and transition from that eccentric to that concentric. You want to make sure that you're standing on this the right way and that you have wrapped this balanced, because if it's not crisscrossed perfectly through the front and the back, one side may pull more than the other, and then now you've got a discrepancy here. So the only caveat to this is getting into it can be a bit challenging by yourself. So me getting into this by myself was a little bit difficult, but when you're working with a client, you can easily have them step in, flip it over, and then have them step in the other one. So with a partner, much easier. Individually, a little more difficult, but still a nice variation. Another variation of the suspender squat is to actually use some anterior bias, what we call anterior bias, meaning that we are getting a pulling force forward so that I don't have to focus so much on my body mass as I squat. It actually, the band actually takes the tension and kind of disperses it so that I can actually get better range of motion, but without the requirement of full control of my body mass. And so with this, the first thing you want to make sure is that they, again, like the last one, they crisscross in the center of your back, because if not, it's going to create some rotation. So you want to make sure that as you put your suspenders on, that it is centered. If it's not centered, you will have a rotation, which can obviously throw off the pattern and the support. And then the first exercise there is just that suspender squat with a chair. So we're just dropping down. This allows us to start learning that pattern, but we have a little bit of that assistance pulling us up and out. This is a great exercise for your senior that may not have the best sit to stand, that may be a bit weaker, that may need to really train this neural pathway and this pattern first before we start getting it in a more independent or isolated way. this can be very helpful to get into the pattern, but have some assistance as we're going through the pattern. So it's a great place to start. The next phase is the lunge matrix. So the lunge matrix is a modified gait pattern, right? We talk about walking. Lunging is a form of walking, but again, how we lunge is important. How we lunge is important. Obviously, depth will challenge muscle differently, but we'll also put a different type of stress on both the hips and the knees. A couple things to consider real quick when we're looking at the lunge. One, your stride. The wider your stride, the more stress it will put on the back knee compared to the front knee. Further, with that wider stance and upright torso, it's going to work more of the glute in your pattern. Of course, the glutes and the quads are both going to contribute to a lunge pattern, but with a wide stance, and an upright torso, we're going to get a lot of glute work because we're going to have that vertical shin. Obviously, the deeper we go, we're going to get a little bit more glute as well. Of course, again, that wide stance puts a lot of stress on that back hip flexor. So if we don't have good range of motion, that's going to cause some discomfort. Conversely, if we have a shorter stride or a small stride and we lunge down, it's going to put more stress on the front knee because that knee is going to track further over the toe. But that also does engage more quadricep. So when you're looking at your lunge pattern technique, it kind of depends on what you're trying to accomplish. Keep in mind, any lunge pattern that you do is going to work both glute and quadriceps, but typically your first go is just a natural stride, not an excessively wide stride, but a wide stride so that you can have that vertical shin. If we have that nice upright torso and we drop down, we are going to have a nice balance of quad and glute. Probably a little bit more glute because of the position, but glute and quad are both going to contribute to that lunge. Having said that, take a look at the different patterns that we can do. We have the deep and the partial. So you can see just that partial lunge here where we're not going all the way down. Focus of this is trying to get that vertical movement, right? That we're not leaning too much into the lunge, that we are stepping and then dropping down. I like the lunge because this is one of the only exercises that is not in parallel. In other words, the front leg and the back leg are doing something separately and they both have to stabilize the hip, because if not, we're going to have some rotation going on at the hip, which can create imbalance and a lack of core engagement. So lunging, I think, is really good because it not only challenges that stability that we've been talking about, but also challenges mobility, right? The ability to actually get into a stride. So if we have tight hip flexors, we will feel it with a lunge. And that, again, can be indicative of something that we need to work on. The next one here is just deeper. So we're getting to that deeper lunge pattern, again, for your more advanced seniors that have that mobility and that control to get all the way to the ground and up. Again, this is a great goal, to be able to go to a low and deep lunge and stand up, because if we do trip or if we fall or we find ourselves in a half kneeling position on the ground, being able to get up without significant assistance can be a huge difference between dependence and independence. So we want to make sure that that's something we're really reinforcing. Of course, we can add some dynamic element to it by walking. So now we're adding some momentum and we are going to add a walking lunge. Now it's being able to transition, push off the ground and get into that full swing of our gait cycle and continue that. The big thing we don't want to see is a bunch of trunk rotation or flexion and extension. We want to have that nice upright trunk and controlling this with our hips. If you start to see a lot of hip or trunk movement, we have some compensations going on. So you want to address that pattern. Of course, we can take it to the next level with some resistance. And we've kind of seen some variations of this with the walking, but now we're just adding a lunge. Keep in mind that each stride you take is going to be more difficult. It's going to be more difficult because you've got even more tension. Trying to control that is really important, really important. Start to see here this deeper position. See guy in the second video, he's just going much deeper and it's much more challenging. And again, trying to control this with that good upright neutral spine, keeping core engaged and moving with the hips. The last focus that we have for this webinar is the hinge and that hinge matrix. Hinging really is essential. It is the beginning of most of our lower body movements. I like to talk about the squat first because I like to see the whole thing together and then kind of deconstruct it to show you the hinge, because when you focus on the hinge, sometimes there can be some lost in translation things going on. People struggle with the hinge when you put a focus on it, but most of them do it without thinking about it. But when we actually isolate it, they struggle with it. So with the squat, we talked about sitting down. When you are about to sit down on a chair behind you, what are you going to do? You're going to move the hips back in order to sit. That movement, in essence, is a hinge. But we want to make sure that we can control it. That's the difference. Most of us, specifically our seniors who have not been training, tend to start falling back down into their seated position versus hinging and then squatting down. The hinge is actually a very important critical component to a squat pattern, but also a deadlift pattern. And a deadlift pattern really is just picking something up off the ground. It is a little different than a squat. I will differentiate that here momentarily. But with the hinge, really the focus that we really want to emphasize is that the movement is initiated with our hips, not our trunk. When we think about a hinge, most people think about bending over. That is not a hinge. That is trunk flexion. A hinge is when the hips move posteriorly. In other words, the hips move back. That movement, that is hip flexion, that will naturally cause the trunk to flex forward. When we hinge, that movement is the hips. The knees will come in later, and that comes in later when we're either squatting or deadlifting. The hinge is the hips. The hinge is the hips. That's something that I say all the time. Hinge is the hips. Hinge. The hinge is the hips because that's the movement. The glutes or the hips moving back is the primary movement, and then the trunk will follow as we flex. Coming out of the hinge is just as important. Again, most people will lead with their shoulders and their back and rock back. They will extend their trunk. So they just pretty much go forward and back. Again, incorrect. To hinge, hinge goes back with a posterior movement. To come back up, we are actually going to initiate that with the hips. We're going to squeeze the glutes together to move us back up. And of course, the trunk will assist, but the movement needs to be the trunk. As simple as that seems, it's very difficult for many people to actually improve that mind-muscle connection. They don't actually have very good control of this pattern. So teaching it is really, really important. What is the difference between a squat and a deadlift? Well, they both have a hinge pattern. We have those hips that move, but a squat, you'll see much more movement at the knee versus a hinge where you're going to have much more trunk flexion. We will have some knee flexion for sure, but that we're going to have a lot more with our hamstrings and our glutes as we flex at the trunk and then stand back up. That deadlift pattern becomes more posterior chain, whereas a squat that does have posterior chain elements is going to be very anterior chain because of the quad dominance of most squat patterns. Again, as I've said, of course, both anterior posterior chain muscles will be contributing. It's synergistic, but we can emphasize it based on how we execute the pattern. So having said that, how do we teach and improve this hinge pattern? Well, the first one is one of my favorites, progressive wall taps. Another silly way to call it are butt kisses, where you are about 4 to 6 inches from the wall. We have a soft bend in our knee. Our knees are never locked out with a hinge pattern. We have a soft bend in the knee. And what we're simply going to do is we're going to reach our hips back to touch the wall. If we touch the wall, we again use our glutes to come back up. We move ourselves forward a little bit. We just keep going out until we reach that point where we really are having to reach and stretch back with the hips. When you reach that point, you should feel this through the glutes and the hamstrings. You should feel that stretch. Further, we should not be falling back on our heels, which means we're not controlling this with our hips. We're shifting our weight back. The hips should go forward, and we counter that with a little bit of that trunk flexion. Let's take a look at it. We can see here that this exercise is progressive. We are going to slowly increase, you notice I'm not just falling back into the wall, that I am staying stacked. That as I reach my hips back, my trunk comes forward, my toes are not coming up off the ground, I am hinging. I am hinging this pattern here. It's a great way to start training this and getting used to this pattern. We can also do this with a supported variation. And the supported variation allows you to take the weight distribution out of it by holding on to something solid and just reaching back. Because what a lot of our clients do is if they don't have good control of their hips, they lean back into that hinge and start to fall back. By simply putting all that weight forward, holding on, they can literally just focus on that hip shift, that posterior hip shift. And you can see here, I am just simply sticking the hips back, right? Pushing the hips back. That's really the focus. Again, we want to obviously clean this up and get to that point where we can hinge unsupported, but this is a great way to train the hinge pattern for our clients that struggle with it. This next part is increasing the degree of our hinge. And again, as we get further and further, we start to get more into that deadlift pattern. Very important to recognize the difference. And that's why I like this matrix approach. The matrix approach takes a movement and builds upon it. And you can do that with any exercise. But with the hinge matrix, what I like about this is that we can start more shallow and then get into a greater range of motion. So the 30-degree hip hinge here is simply that. We are just going to have a shorter hip hinge. So it's what I've been doing, what I've been showing, but we are going to get a little bit deeper than what I was doing, but we are stopping rather short. From there, we go to a 60-degree hip hinge, which is just going to get us into a deeper range of motion, more of that posterior hip shift, which gives us a little bit more of that trunk flexion as we reach our hips back. Very different than a squat pattern. Very different than a squat pattern. Remember, the squat pattern is all about that hinge into more knee flexion as we descend. The hinge is going to move the hips back. From there, we get into that deeper hinge, the Romanian deadlift, where what we have here is we are getting deeper. We're getting right about to that point right below the knees, which is about right for that Romanian deadlift. And then for us to go any deeper, we're going to start to have to get the knees involved a little bit. And that's where that conventional or functional deadlift comes into play. That is the deadlift that we think about. Of course, in the weight room, we're thinking about a barbell loaded, but this is a modified hinge, obviously, but with much more knee flexion, but not the same as a squat. A big difference when you're looking at a squat versus a deadlift, the deadlift pattern, the hips should be above the knees. The squat, typically the hips are even with the knees or deeper with the knees. So when we take a look here, we're going to see that hinge pattern, and right there you can see that guy is lifting with this hinge pattern. You can see that his hips are above his knees. He's hinging and using more of that posterior chain to lift. So this is a great exercise to integrate, because when we want to pick things up off the ground, perhaps it's a bag of groceries, perhaps it's a grandchild that we want to pick up. By simply bending over, we could put a lot of stress on the lower back, but by hinging and doing more of a deadlift pattern, we have much more stability and, of course, much more posterior chain muscle activation. Another great way to actually really reinforce this is to do a band resisted hip extension. So this is actually going to do two things. It's actually going to force us to hinge, because the band is going to pull us into that hinge pattern, which can be very beneficial. It can actually force teach us in a way, right? Because the band is actually going to pull the hips back. But then also it is going to focus on getting those glutes to extend more, because we will be extending against resistance. So just taking a look at that, you can see that the band will pull me back, and then I'm going to use my glutes to move me forward. I will not move forward if I don't engage my glutes. If I just simply pull up with the trunk, I'm not going to get up very well. The band's going to pull me back. The only way for me to really come up is to actually extend those hips or extend the glutes to really get me into that position. So this is a nice training exercise, but it's also an exercise to teach the movement patterns. So with that, that concludes our strength training exercises. Thank you so much for joining me in this webinar. I'm going to wrap up today with a few notes that, in case you missed at the beginning, we want to make sure that you understand and have so that you can get all the things that you need. So first and foremost, let's review one more time how to get your CE certificates. First, view the complete webinar, which you just did, and congratulations on completion, and thanks for joining me. Finally, after that, log on to the website, www.exerciseetc.com. Click on Administration at the top right of the screen. Click on Strength Training Past 60 from the drop-down box. Enter your email address to verify the purchase. Complete the short 20-question quiz that is required. Complete the brief evaluation. Fill out the other required fields and click Get Certificate. And your certificate of completion will be emailed to you instantly. And if you don't see it, check your junk or spam folder. Sometimes using things like Gmail, for example, will send things to the junk folder. So make sure that you check that, because some junk folders even will delete spam emails if they're not looked at or recovered in 30 days. So you just want to make sure that you check those folders. But rest assured that if you do the above steps, it will be sent to you immediately. Final reminder that the webinar quiz is based on the printed material in this handout, not on the lecture. The webinar quiz sequentially follows this outline. We have reached the end of this webinar, and I want to thank you so much for joining me. Hopefully now you have a great grasp of some of the strength training exercises that you can do with your seniors to continue improving their functional capacity, but also their independence. And hopefully you have some ideas that will be creative, that are versatile, and also easy to do anywhere. I want to thank you so much again for joining me. I want to thank you for choosing Exercise Etc., and we look forward to working with you again in the future. Take care.